Well, thank you for the applause before I start. I'm never sure whether I'm going to get applause afterwards, so I'll take what I can get. Can I start by thanking CogX for inviting me here today? I am really excited to be amongst so many like-minded people who believe in the transformational power of technology. And I will admit, I'm a self-confessed geek. In fact, I've been a geek so long, I'm now the father of geeks, and they show me up. From the days of programming, I'm going to test your age here. From the days of programming Sinclair ZX computers, BBC Micro, are you all much too young for that? Probably never. Probably your granddad told you about it. Writing machine code at university, wrote Fortran at university, to my current role at looking at how AI and better sharing of data technology can deliver both better health and better social care. And I know one of the critical questions posed at this summit has been, how do we get the next 10 years right? But in one way, anyone who's worked in technology knows that while you can assume that some of the technology being developed by companies and inventors and in labs today may well be commonplace in 10 years' time, some of the predictions would inevitably be wrong. While at the same time, there will be some technologies that we have no idea about today, and they will disrupt the markets of the future. But whatever our predictions about technology, we know that the next 10 years are crucial for the health and care system. We need to make sure that we have a fully digitized health and care system that leads to joined up and better patient care from birth all the way through an individual's life. And we have to also make sure that we address concerns over how patient data is used. And if we can get this right, the NHS has the potential to become a real innovation partner and be at the heart of an ecosystem with developers and partners from life sciences, health tech, and care tech. So we can help people live healthier lives, help them live healthier for longer, support incredibly busy staff, but also make the best of scarce resources. And through innovation and technology, we will prevent, diagnose, treat, and cure a much wider range of disease than is currently possible. And as we set out in the Life Sciences vision, to achieve this, we need to build on the UK's world-class science and research capabilities to help make the UK the best place in the world to trial and to test products. But we can't do this alone, and we need your help to achieve our vision. And I believe that working together, we can create an outstanding business environment for technology companies, where incentives and structures are aligned to help to support the growth of your companies, while at the same time driving new innovation and investment. And only when the NHS becomes a better partner for innovation can we really make this vision a reality. So today I want to talk about three specific areas. The first one is data for research, ensuring that we make the best use of the rich data that we have to develop the very best technologies and solutions. Using artificial intelligence to improve decision making and diagnosis, as well as freeing up critical time. And nurturing the right environment for innovators to work with our system of health and care to drive the adoption of digital health technologies. Now, data has been transformational throughout the pandemic. And we recognise this in the Data Saves Life strategy, which was published yesterday. And this sets out the government's ambition to harness the potential of data in health and care. But at the same time, we must make sure we do that while maintaining the very highest standards of privacy and ethics. Better use of data will support the NHS services in the recovery from the pandemic. It will give health and care professionals the information they need to provide the best possible care, and it will empower researchers to not only monitor the long-lasting effects of the pandemic, but also to develop life-saving treatments, diagnostics, models of care, and new insights. But we also have to learn from the past, where we did not always gain the trust of the public and clinicians in understanding how their data can be shared better for direct patient care, and how appropriate data can be used by partners in industry and academia to develop improved services and new treatments. So that's why the government is committed to implementing secure data environments. Now, you may have heard some variations of this. They're sometimes called trusted research environments or data safe havens. And these will allow researchers and innovators to access appropriate data via an online platform, but also reassure the public and clinicians about the quality of the data, about security, about transparency and privacy. And we're spending up to £200 million in NHS data infrastructure to make research-ready data available to researchers in a streamlined, secure, and privacy-protected way. But we're also putting in place an infrastructure to make it easier for you, the innovators, to navigate the complex system and to better use the data to develop novel health-improving technologies. Now, by March 2025, we will have an England-wide infrastructure of high-quality linked datasets from across the NHS, including genomics, imaging, and pathology that user innovators will be able to access for research and rapid product development. But to achieve this, we will work in partnership with civil liberties organisations, as well as Professor Ben Goldacre, the author of the recent report on the use of data in research, and the National Data Guardian, as well as engaging with members of the public directly. We have to remember that just because the NHS or the Department of Health and Social Care calls them trusted research environments, it doesn't mean the public will necessarily believe that they can trust them. And we have to build that trust. And we can build the best system in the world, but it will be useless if it is not trusted and people opt out. For fellow Jimi Hendrix fans, we can't build castles made of sand, since as Jimmy sang, castles made of sand fall into the sea eventually. I'm sure he sang it much better than I would. So digitization and data sharing will also create those large data sets needed by machine learning and AI systems to help out health and care professionals make better informed decisions. But we should not get carried away once again. As Kate Crawford wrote in her recent book, The Atlas of AI, AI is neither artificial or intelligent. And while AI can be used for all sorts of jobs that were considered mundane in the past, speed reading legal documents or doing the first sift of CVs for recruiters, we have to be clear that we're really talking about using large data sets to identify patterns and trends that in health and social care can help human decision makers to make more informed decisions. And the NHS AI Lab was set up to accelerate the deployment of safe, ethical, and effective AI in health and care. It has the potential to make the best use of clinicians' expertise, informing their decisions and saving them time. And the NHS AI Lab has funded and monitored the deployment of AI solutions developed by innovators through the AI in Health and Care Awards, so that we can assess and evaluate if and how AI can benefit patients. And there's some really transformational products that have been funded and developed through the award. And I'll give you a few examples. Brainomics, which uses AI to interpret acute stroke brain scans. Or Healthy.io, which uses AI to detect early onset of kidney disease using your smartphone camera. And the AI Lab funds and supports these solutions to be trialled in more areas. And that allows the NHS to develop methods to evaluate AI solutions in the real world, as well as understanding which technologies have the potential to be rolled out nationally. So, for example, Aidence has developed enough evidence to be part of NHS England's targeted lung cancer checks, the first large-scale cancer screening supported by AI. And the award has given out about £100 million to date, including 80 AI technologies across cancer, stroke, or mental health. And there are currently 183 live trials in 164 different sites in the UK, supporting over 100,000 patients to date. But once again, we always have to learn from the mistakes of the past. And I've had a couple of bad experiences where technology was seen as a substitute for human interaction. And I'll quickly go into them and tell you how relevant they are to health. In one case, I was denied a board into a plane when I scanned my pass at the boarding gate, even though a few minutes earlier I had scanned it to get through security. And I was gaslighted or lied to by at least 4 airline staff. Now, this behaviour may be seen as part of the business model of a budget airline, which claims to be the web's favourite airline. But imagine this happening to a patient waiting for a crucial operation. That's why we have to learn these lessons. I'll give another incident. An app-based bank using AI with the slogan, "Banking Made Easy," refused an application for a prepaid card. Fine. But the app then sent me a message saying it did not have to explain why. Where was the human interaction there? Can you imagine that message being sent to a patient trying to book an appointment on the NHS app? That's why we really have to make sure there's humans in that process, and you don't rely too much on the technology. And we've all seen articles about bias in data sets or AI algorithms leading to racial discrimination. And I know, sorry, but maybe I need more water. And I know you've discussed this here at the summit. And that may or may not be why I was treated so badly by both companies, but I will never know. But what I do know is that AI must be there to help humans make better decisions. But in health and social care, humans will often need to be the ultimate decision makers. We also need to make sure that the data sets reflect the rich diversity of our great country, and that those writing algorithms avoid building in their own biases, intentionally or unintentionally. And the NHS AI Lab is helping the workforce to get on board the AI journey safely and ethically. And we hope to do so in an open and transparent way that increases the ability of frontline staff to use AI practically. I hope one day that not too long in the future, clinicians across the whole system in every NHS trust will be supported by the very best AI technologies to help them diagnose and treat patients. Catching cancer at an early stage through enhanced screening programs supported by AI, and greatly improving cancer outcomes and outcomes in so many other areas, including cardiovascular, mental health, etc. And since they can provide alternative ways to access the help that people need without necessarily having to see a clinician face to face. So one example is the progress that we're seeing in providing cognitive behavior therapy digitally. So, huge potential, and come with us on that journey. But with an aging population and more awareness of physical and mental health conditions, demand for health and care services is increasing. One of the things that we often discuss in the Houses of Parliament is that if you think about how we look at health and care these days, people are living longer, they may be living physically longer, but then we've got more incidents of Alzheimer's and dementia. At the same time, we're aware of so many things, particularly in the area of mental health, that only a few years ago you would have told someone, stiff upper lip or pull yourself together. We're actually understanding now, the different forms of mental health. And then neurological conditions. When I had to do a question the other day in the Parliament, I was surprised to find out there were 600 neurological conditions. So it just shows how much more we are aware of, which presents even more challenges to our health and care system. Given these pressures, we must focus our efforts so that the most clinically and cost-effective technologies can be used by clinicians and patients to help manage some of that demand where appropriate. And my department is working with the Medicine and Healthcare Products Regulatory Agency, MHRA, the National Institute for Clinical Excellence, NICE, NHS England and others to reform the assurance and commercial pathways for digital health technologies so that new products, treatments and devices are assessed effectively for clinical and cost effective. And we want to make that pathway easier to navigate for product developers by helping you to enter the system of health and care, but also being able to scale up your product for adoption across the whole system. As you can see, my job is not only exciting, but it keeps me busy. And I hope I can work with those of you who have exciting solutions and want to scale up and want to become NHS trusted partners, but swiftly, safely, and securely. There are many challenges for the health and care system, not least clearing the post-pandemic backlog. But with a better use of data, new innovations and technologies, we can build a better system of health and care in this country. And thanks to the confluence of innovations in research, life sciences, digital technologies, and new materials, these are really exciting times ahead for health and social care. And I know that my department and the NHS look forward to working with you on that journey. Thank you.